You're seeing the document, right?
Yeah.
So, mm,
Recording.
uh, I didn't start. I thought I start. Recording has started. Yes, yes, it has started. You can off the cameras if you want. So, headache, as I told, it is in the whole location, whole head, forehead, vertex, occiput, wherever, base of the brain, extending to eyes and temples, all the head region. With the bad effects of fear, we already discussed fear of being poisoned, and the remedy for this will be hyoscyamus. A characteristic mental condition will be but loss of sense of location. When on streets seem strange to him. This is more important. And in Kent, the same symptoms but presented in a different manner. There is surging of blood to head and heart. That is associated with a warm, blowing sensation. There can be wave-like sensation. So it is more kind of, the Kent's lectures, we see most of the things he explained in a poetic manner. Even the dosage, uh, and not the dosage, the potencies to give, he had told us to follow the rule of octaves. So we can see everything, something, when Ken writes, it's more poetic way he tries to explain the things. There is a wave-like sensation, so maybe we can consider to compare it to the pulsating or the throbbing kind of pain. There is intense pain and throbbing sensation like beating with hammers. So what exactly throbbing is that? I don't know what exactly can meant by wave-like sensation. Maybe that pulsating nature. Then aggravations in case of this surging or congestion that is happening in the head and heart. Along with this concomitants, there will be the aggravation and amelioration. Aggravation, as we already told, the least motion, jarring, whine. When I say whine aggravation over here, somewhere above, I have told that brandy is actually amelioration for them, isn't it? Yeah, brandy is amelioration, but actually whine is aggravation. And whine aggravation, we can see in another drug that is zingamet. Um, then warmth lying with head low. Amelioration in a quietude situation when it is calm, quiet, open air, cold, and long sleep. And this is important actually in case of Kent when he explained. So that can be considered as a clinical tip also. If the person is having amelioration from headache after a long sleep, but aggravation from a snap, then it is more going towards the glonoid. So long sleep is an amelioration, but a small short sleep or a nap is actually aggravating his symptoms. So if he sleeps for a while or taking a nap, and if he's made to wake up in between or a short term sleep or a short while sleep, that is going to aggravate his headache. But once he wake up from having a full sleep, a complete long sleep, then his headache ameliorate. That is much characteristic of glenoid according to Kent. But the extremities, and this feature I told you how to differentiate between glenoid and belladonna. Over there I told you in belladonna there will be uniform redness, there are heat throughout the body from head to foot. But here in case of glenoid, according to Kent, the extremities will be cold, pale, and perspiring because the blood rush of blood happening to the head region. The head will be hot, face will be flush purple or bright red, but the extremities will be cold, pale, and perspiring. And in case if it is sunstroke, the symptoms in case of sunstroke will be, it will be the common symptoms so that which we learn in sunstroke. The pupils will be dilated, the eyes being red, the tongue will be dry and red, and sometimes this reddishness, it will be even moving towards a brownish tint. The eyelids will be getting dry and sticking to the eyeballs. There is confusion of mind with loss of consciousness. So these symptoms actually what we say, it is much similar to the common symptoms because in case of sunstroke, the pupils of course will be getting dilated. That's what when the people who are having sunstroke and they have that dizziness or vertigo and they fall down, everyone will be looking up to in their eyes actually. In the movies and all we can see. That's to see the pupil dilation because of the heat. The blood vessels are getting dilated. So the pupil may be dilated getting because of that. I'm not sure, but the pupil will be dilated. The tongue getting dry because it is sunstroke, heat exposure for a long time. Definitely the person is getting dehydrated. So the tongue will be dry. Even the eyelids, because of that dryness, it will be dry and sticking to the eyeballs. There will be confusion and loss of consciousness. This, with all the symptoms, you can see it's a common pathological symptoms associated with sunstroke. Then some clinical tips which I found to be very interesting in Kent. In conditions of hyperemia or congestion of the brain, when we told that he may lose his sensation or that sensation of location where he is. So there's a nice way in which actually Kent has explained that. So there is hyperemia or rush of blood to the head, and it comes in spells, one after another, comes in moments when he least expects it. While walking on the street, he feels a surging to the brain like a flush of heat and flush on the face. His hand tremble and the hand and feet become cold. He breaks out in a sweat. He looks around at that congested stage and he does not know which way to go home. He does not know where his dwelling is. So that's how Kent explaining us that loss of sensation of the location. Not just that, how now this one we can imagine better a person who is having such a congestion, having all these changes going through in his body with that trembling, sudden perspiration, and then he is losing his location sensation. He looks in the faces of friends and they seem strange. He loses his way when he is near to home, but this confusion, it soon passes away. Like what I told you, meronomial it is complete amnesia actually. It is not amnesia over here. This completely passes away and he feels better again. But these spells, later it will be coming together closer with very much frequently, it will be coming together. And that symptoms we can see in the earliest stage of brain softening. So this symptom can be used as a clinical tip for the thing. So this is associated with dizziness, must take hold of things, and all the other symptoms we have mentioned. So hyperemia in congestion, that's how we explain. And the second thing is in case of threatened apoplexy or stroke. So, you know, in case of stroke, it happens due to mainly two reasons. Either there is an infarction and the blood is not reaching, or there is a hemorrhage and a clot is being formed, and because of that, the blood is not reaching. So, in case of apoplexy, especially if it is due to hemorrhage, when the apoplexy or the stroke has taken place, and if the violent pressure keeps on, think of this remedy. So if there is a stroke, and if it is due to hemorrhage, and hemorrhage might have happened due to some aneurysm, and aneurysm means when there is a dilatation of the blood vessel. So because of there is an increased hypertension, because you know in case of stroke, it usually happens in people with hypertension. So in case of hypertension, suddenly if there is an aneurysm or the hemorrhage is happening, in those cases, if it is threatened, like it is going to happen, or if it has already happened, and there is a violent blood pressure, then think of the remedy. So here it is not the clot that is at the first place to take the life. It may be outside of the lifeline, but it is the congestion that continues, the blood clot will increase. So what Kent meaning here or is that what Kent is meaning is in this case, it is not the blood clot that is causing his death. The blood clot may be smaller in size, but if the blood pressure is remaining high in that patient for a longer time, and if we are not addressing that blood pressure, then the congestion is going to be increasing or the hemorrhage will be continuing increasing. And this continuation of the hemorrhage can result in a bigger clot, and that may result in the death. So it is not the size of the blood clot, but because if there is a blood clot, the better medicine will be like a arnica to absorb that blood, to think about. But here it is not the clot that is the main problem, but the blood pressure. So in those symptoms, the medicines that we can think about is opium and also glonoine. It relieves the blood pressure when the symptoms agree, and they will equalize the circulation. The patient may not die. A paralysis, because if the apoplexy has taken place, then you know kind of paralysis can happen. It can be affecting one arm or leg. But anyway, this will, by physiotherapy or something, this is going to go after a while. And at the end of many weeks or months, the motion will be regained and the patient will be, of course, recovering. But in this case, when the patient had the apoplexy and he was having high pressure, and we didn't give any medicine to reduce that BP, if that had happened, the blood pressure will be continuing, and that will result in continued congestion, and then certainly the patient will be dying in a few days. So that is how Kant brings it out. When the congestion is happening or the hemorrhage is happening, and then a threatened apoplexy, we shouldn't bother about the blood clot. It may be a size bigger or smaller, but that is not the thing. If the BP is remaining high, we should do something to reduce the BP of the patient. So this is not going to clear the stroke symptoms, the paralytic symptoms, had it happened. But if you don't address that BP, the person will definitely die. But if we address the BP using the medicines opium and glonoine according to the symptomatology, definitely the patient may have some paralysis effects, some remnants, but it will go off after some time. But if we don't address, he may die in few days. So that was two interesting clinical tips that I felt like to share with you. And another common symptoms in this congestion will be tumefaction of the neck. Tumefactions means it's congestion also, or a sense of swelling. That is tumefaction. The neck feels full. The collar must be opened as it causes choking, as if he would suffocate. So lachesis also is another remedy which we'll remember when we say this collar should be loosened off. They can't bear anything tight in the neck region. And lachesis, the same medicine can come with the comparison with the glonoine also. Then the next circumstance is in the case of catamenia or menses. It's an old terminology for menstruation. The menstrual flow does not appear. It is delayed with violent congestion to the head, violent headache, and already the symptoms described. So we can give in these things glonoine. So remember the headache, the congestion, the throbbing nature, the loss of sensation of location, the nature of expansion, then the symptoms related to sunstroke. Then whenever in case of what is that? Catamenia, even the menses that getting suppressed or uterine hemorrhage suddenly getting arrested, and there is a rush of blood to the head region and the heart region, causing even angina pectoris or laborious action of the heart. We can think about glonoine. And everything that is heat, hot, warmth is an aggravation for glonoine, and cold will be amelioration. A long sleep will be amelioration, but a short nap will be aggravation. Any doubts in case of glonoine you want to discuss? Have anyone given this medicine, glonoine?
No.
Actually, once I gave, it was a random prescription. I shouldn't have done because not glonoine actually, lachesis. Because lachesis also has got this high pressure, and then nothing related to glonoine, okay, but I'm just saying high pressure and also for the menopausal women. So my mom was having high pressure, And she is actually, I always felt it's a pulsatilla type, but pulsatilla was not acting. And then I thought, okay, I will try with lachesis. What is going to happen? We'll see. Nothing happened, okay? PP never reduced. And that's the time I understood. Sometimes when we don't follow the symptomatology and just give randomly some medicine, that's why I don't trust even the tinctures. It doesn't work because my mom is never a lachesis. Then I was trying to work with that. It never reduced. But as I told you, I was not mentioning about the clonine. It's just the symptom match is always required. So I hope you understood the main features of clonine. I'll go to the second remedy, that is Hydrastis canadensis. Its common name is gold seal or orange root, and you can see why it is called so. We are taking the fresh root, which is yellow in color, so that is why the common name. And it's belonging to the family Ranunculaceae. Aconite is also belonging to the same family. And another thing, because this is golden in color, now we go towards Hydrastis. We'll see that one of the most important feature of Hydrastis is its characteristic discharge, which is actually golden yellow in color. So this is a doctrine of signature that we can apply. The roots color being yellow, and in the symptomatology, we are going to get the discharge, which is very golden yellow and stringy in nature. So just a doctrine that is being applied. And the picture, that's actually the root of the plant. The plant as such, the Hydrastis will be like this. But here we don't see any golden color, yellow color, nothing. It's just the root that is the color. So just to show that contrast difference, I put this picture also. Clinical condition, as I told you, it is indicated for cancer. Any type of cancer, other symptoms should match. That is the main criteria. It can be given for sore throat, ulcers on the mouth, and it is actually one of the best mouthwash. Have you heard that given as a mouthwash, Hydrastis?
No.
Yeah, Hydrastis clinically you can give because I have given a lot of times and it really works.
For ulcer,
Especially,
is it?
huh?
For ulcer.
Yeah, ulcer, the aphthous ulcer, and also even the sore throat. Uh, yeah, like a mouthwash, we can use it. Has got some antibacterial property. Now I don't know whether antibacterial or anything, but it is a good remedy for us to give mouthwash because sometimes when the patients come now, when they have these ulcers, because they're so accustomed to the allopathic mode of medication, they will be like the patient will be sometimes asking, doctor, we don't have to use anything externally, nothing to wash or something, because they will be advised to use some, especially in case of sore throat, some kind of mouth wash. So they ask at that time, if someone is asking you, Hydrastis tincture is very good. So never, because it is tincture, it is never given directly. Of course, you have to ask the patient to mix 4 or 5 drops in some lukewarm water, like maybe a half glass, and then ask them to gargle it. It's very effective for the ulcers, the sore throat, even the tonsillitis condition. But in tonsillitis, I wouldn't advise because we will never know whether it is the Hydrastis that acted or the internal medicine we give. Which acted, we will never know. But anyway, this is a good remedy for as a mouthwash. Then this can be given for tongue affections, the ulcers or the aphthous ulcers, liver affections, even in liver cancer, and also in jaundice condition, constipation, hemorrhoids, menorrhagia, metorrhagia, these conditions we can give. So the characteristic feature, it is mainly, I think I would have taken it from J.H. Clark. The yellow color of roots is very intense and it has been used by Indians as a dye. The medicinal property of Hydrastis were known to the aborigines of America. And even at that time, the aborigines of America, they used to use this medicine Hydrastis in the treatment of cancer. And when we did the proving, even our therapeutic symptoms were also online or in line with that, with the indications that the aborigines of America had. It's a cancer remedy. It's also indicated in precancerous stage when the person is having a period of undefined ill health without any discernible new growth. So that can be like it can be given for ulcerations, the malignant ulcerations, the cancerous condition, yeah. But it is also indicated in the precancerous stage when there is no discernible growth, but there is a kind of ill health always associated, undefined ill health, because we can see later the main problems of this drug is in the stomach. There will be something, the dyspepsia, indigestion, all these things happening. There is a defective assimilation that is happening. So defective assimilation, as like we say, the other remedy is Calcarea force and Silesia. So similarly, we can see a defective assimilation in this remedy also. So there will be a undefined ill health. This change is marked by the symptoms of dyspepsia, because whatever the patient is taking in, it is not giving him any nutrition or strength to his body. So it will be always in a ill health. The facial expression will be dull, heavy, sodden looking. Sodden looking will be like a very dark, like some grayish deposits. It's not actually the grayish deposits has happened, but when you're physically very weak, even your face will be looking very tired, uh, very dark also. Um, so that will be the facial expression. Now, yellowish white in color, especially if the person is actually fair. In case of dark complexion person, they will be more sodden looking, but in case of fair complexion, they will be having a yellow white color. Just show the a kind of malnutrition, yeah, but a defective assimilation. That would be the better term to say. They will be having food, but nothing will be shown on their body. Uh, then the tongue is large and flabby and slimy looking with indentation by the teeth. And this is something I have, I don't know whether I have told to seniors, but for I have told you this, any medicine that is having action on the liver, their tongue will be large, flabby with the indentation of the teeth. So we go for the medicines, Rustox, Mercurius, Podophyllum, and what else? Most of the liver remedies, natron salt, they will be having this kind of tongue. It is a common feature of liver affections to have this large flabby tongue with indentation of the teeth. And we earlier also saw that this medicine can be given for liver complaints, the jaundice, etc. So the tongue will be very characteristic. So the general features, there is a cachetic or a malignant dyscrasia, which means a cancerous tendency, with marked derangement of gastric and hepatic function. The constitution will be broken down by excessive use of alcohol. So we can connect it like that also. Chronic alcohol, finally ending with some liver complaints and then liver cancer, because Hydrastis we can think about, and they will be very debilitated or tired with viscid mucus discharge or the thick yellow stringy mucus. Now that is the 3 mark point. Whenever you mention about hydrastis, this is a feature that you shouldn't forget, that particular nature of the discharge. So anywhere now when we go towards the other symptoms, you'll see that there can be discharge from the eyes due to the eye inflammation, from the nose, from the larynx, the bronchial tubes, from the ears, the otoria, then from the anal region or the menses, whatever, I mean, not the menses, the leucorrhea, everything will be having this stringy nature, which is yellowish in color. So remember the root, the common name, the hydrastis, and also this specific feature. So apply and never forget, is a general characteristic of that drug. You write the cancerous condition, but you don't mention this particular nature of the discharge or the discharge of hydrastis. You won't get the marks actually. So this is the main keynote of that drug. Pain of cancer before ulceration sets in. Then this we have already told, the nursing sore mouth, Even the women who are nursing the babies, they will be having a sore throat. And if a baby is nursing, so those mothers, and also if a baby is nursing and they have nipple affections, then also we can think about hydrastis. It's coming in the later part actually. The tongue, it will be large, flabby, thickly coated with imprint of teeth. Respiratory symptoms, they hawk yellow viscid mucus from the posterior nares and also from the fauces. There will be ulceration after mercury or chlorate of potash, and in case of syphilitic angina. When the term comes syphilitic angina, they actually mean the condition Vincent's angina. So Vincent's angina, we say angina, maybe this I have already told you when I was taking practice of medicine. And I think I even asked you one question based on this Vincent's angina. Because when we hear the term angina, we only remember about the heart attack, the angina pectoris. But this is nothing related to angina pectoris. Vincent's angina is actually a condition which is caused by bacteria, two types of bacteria. One is the fusiform bacteria, and the second one is spirochetes. And the spirochetes are actually the organisms which are responsible for syphilis. So that might be the reason that they called it as a syphilitic angina, because all this Materia Medica was written at a time when the microbiology has not been developed. So maybe they knew that it is something related or caused by the spirochetes, so they called it as syphilitic angina. But later the terminology was changed, and that condition is called as actually, it is a condition in which there is pharyngitis and tonsillitis with ulceration, marked discharge coming out. And if we have to give hydrastis, then the discharge nature should be thick, viscid, stringy, and golden yellow in color. And this is actually caused by two type of bacteria. They have to come together, the spirochetes and the fusiform. Fusiform is actually symbiotic bacteria seen in our oral mucosa. But when the syphilis is happening or the spirochetes is entering our body, because of that immunocompromised condition, this symbiotic fusiform bacteria and the spirochete, it will come together and they become pathogenic, producing this symptom. So don't get confused with the term syphilitic angina. That's the meaning. So this is the condition where there is ulceration in the fossa area, the nasopharynx area. This is Vincent's angina. In the female reproductive system, there is leukorrhea, as I already told, the ropey, thick, viscid yellow, hanging from O's in long strings. So we have the Bovista, Gallibite, Chromicum, etc., similar for those conditions, and given for pruritus. Right, this I keep this picture, or to indicate where is O's, the internal O's and the external O's. So even the leukorrhea, if you are going to drawing out, it will come like that, as if it is being hanged down. Then it's a good remedy for cancer breast or the epithelioma of mammary glands. Another good remedies will be conium, phytolacca, sarsaparilla. Asterias. That much I'm remembering now. Okay, so cancer breast, the skin will be mottled or puckered like the orange skin, pudy orange. That's what the appearance is being called as. It will be hard and adherent, like the growth will be very hard in nature, and also it will make the breast adhere to the chest wall structures. There will be pain, knife-like pain, sharp cutting, and the nipple will be getting retracted. And that's a clear-cut sign. If the nipple is getting retracted, that's a clear-cut sign of cancer. You need to be very much aware. But nipple retraction will be usually happening towards the later stages. But that is a clear-cut sign actually. Then modalities, aggravation at night from warmth, motion, touch, washing. from harsh dry winds, especially the respiratory complaints. Amelioration will be from rest and pressure, antidoted by sulfur. We go towards clock, a little more explanation regarding. So I always say you, the first part is just for examination basis, but for the more details, we'll come towards here. So clinical, what is that? We have already mentioned most of it. For the alcoholism, I told you, eczema, constipation, especially if it is associated with hemorrhoids, the liver condition, the jaundice, the gonorrhea, lip cancers of lip, liver, menorrhagia, macrorrhagia, the nipple sore, tongue affections, the ulcer, what we discussed, uterus affections of typhus. Typhus can also result in intestinal ulcer. So maybe the hemorrhage they are connecting. We don't go into that much minute details. So regarding the characteristic, Judge Clark has mentioned that Hale he caught it as the drug Hydrastis as tonic ophthalmic detergent. Now, I don't know what exactly he meant by that. That's just the quotation given, no explanation. So, tonic, okay, maybe as a tonic because it helps in defective assimilation. But when the word ophthalmic and detergent also come together, I really don't understand what that was meaning actually. Uh, and so it just leave to that. I was googling also, but it was like a wash. I wash. That's what they meant. So I don't know whether he was mentioning that this remedy could be used as an eye wash also. I'm not sure because when I was studying or from any of my professors, I have not heard Hydrastis being used as an eye wash. Of course, as I told you, I have heard and I have given it as a mouthwash, but not as an eye wash. So I really don't know how to explain this thing, the tonic. The tonic may be because it's good to fatten the body when there is a defective assimilation, especially in the cancerous conditions. But the ophthalmic detergent, I really don't know. It is said to enter into compound remedies for cancer, acting as a detergent tonic, and the Cherokees are supposed to use it in that disease. What Hale actually meant here was that Hydrastis, uh, as like we saw that in case of abortions, they knew that it is used, Hydrastis could be used in cancerous condition. Even in the therapeutic, when we proved also, we get that the therapeutics mainly in the cancer and like the Cherokees, the people who were before, I don't know whether they are mentioning about a particular person, the Cherokees, or the Aborigines in total. I don't know. And they were also using this medicine, the Hydrastis, in cancerous condition. So this is important as showing that the traditional reputation of the plant agrees with the results of later experience. So Hale is just mentioning that even those people knew that Hydrastis could be used for the cancer, and even in our proving, we got this medicine indicated in cancerous condition. But this sentence, the next sentence is very important, which I have already told you. But by no means this is specific in all cases of cancer. There is no, it can't be told that in any cancer we can use it, or there is a specific type of cancer in which we use it. Not like that, but generally any cancer condition, but the symptoms should apply. Not that there is a cancer and then we give this medicine, nothing like that, but the symptoms should match. And it is shown that it is in cancer cases that Hydrastis has won its chief fame. And I think it may fairly be said that more cases of cancer have been cured with Hydrastis than with any other single remedy. And here the I is actually J.H. Clark. So that much important Hydrastis has got. Not a specific cancer, but not all cancers also. Like blindly you give any cancer patient come, you give Hydrastis. No, the symptoms should match. And most of the claim or the benefits of Hydrastis have been obtained in cancer conditions, and more of the cancer conditions have been cured with Hydrastis other than when compared to any other single remedy. So this I already mentioned the precancerous stage with the color of the face and the tongue, which we already discussed. Uh, then they do have irritations because we saw that the stomach is the main area of their problem. There is indigestion, so there will be irritations, which is generally sour and at times putrid. Appetite is very bad. The power of digesting bread and vegetables will be very weak and causing irritations. So as I already told, with dyspepsia, even the person will be having no thirst and no appetite, and even the digestive capacity is very much reduced. And over there, in the European countries, what they usually eat is bread, vegetables, and because the digestion is so weak, and the indigestion of this bread and vegetables will also lead to irritations, which is very sour. Weight in stomach region with sensation of fullness and empty all gone sensation. These are characteristic of hydrastis, and it is very constant, not occurring at special times like that of sulfur. And there is aggravation after meal. So this is another important symptom of hydrastis actually. There could be a sensation of fullness or a weight in stomach, and it can we'll see the weight in stomach. He had connected it to the cancer of stomach region, especially in the pylorus. So the person is always having a heavy sensation or a weight sensation or a fullness over there, and fullness can be connected to that indigestion, the irritations being accumulated can connect to like that, and also empty organ sensation. And this organ sensation is actually a grand characteristic where it is very constant. And then they have compared that organ sensation is not similar to like that of sulfur, because in sulfur, if you remember that empty organ sensation, we usually say about 11 a.m. Even we go to sorinum, lycopodium, the drugs which usually have this organ sensation, this actually when the stomach is empty, because they take the breakfast and then the lunch. So that mid period around 11 a.m., they will be feeling a hungry sensation. So it is from that they have that organ sensation. And once they eat the food, it is completely gone. That's usually seen around 11 a.m. But in case of hydrastis, it is a constant symptom. It is not like it will come at 11 a.m. only. No, it can be all time present. And also, case of sulfur, you take some food or lycopodium, sorry, then you take some food, that sensation of gone or empty sensation that will be getting relieved, but not in case of hydrastis. In fact, it is getting aggravated. The aggravation after meal, maybe because the weight sensation, because the food is going in, so they have that weight sensation, the fullness sensation that remains constant. Then the action of the bowels, it's either infrequent, that is constipation, or there can be diarrhea. And this one, the stool, it will be a soft, light colored stools, or what is the feature of obstructive jaundice. In obstructive jaundice, you know that there won't be bilirubin, there will be an obstruction. So the feces, it will not be stained or it will not be colored with the stercobilinogen. So it will be light colored stool. So a person who is having jaundice, but the stool is light colored, it will be the obstructive jaundice. So that is why they're mentioning that. In dyspepsia, Clifton, one of the son, Medica doctor, will be homeopathic doctor. Clifton found the tincture and lower attenuations answered the best. In catara of nose and fauces, the higher were better. So according to Clifton, in dyspepsia, it was tincture and lower potencies that was best. But in case of respiratory complaints, the higher potencies were better. And now this is one of the symptoms that I told you, that this catara, like I told you, it can come from the eyes. Catara is the discharge that is coming from wherever there is a mucous membrane, so from any part. The nasal catarrh, the pharyngeal, the bronchial, gastric, duodenal, intestinal, urethral, vaginal, anything, it will be that characteristic stringy, yellowish in nature. So the characteristic catarrh is yellow, white, tough, and stringy. That's the feature. But even though they have mentioned white, yeah, on your exam paper, I mean, clinically you can go if you get the tough and stringy, but on exam paper, because it is not easy to by heart all the things, especially if there are contrasting symptoms. So just remember yellow, yellow, tough, and stringy. That will do. The action on the skin is also very much marked. The person, Garth Wilkinson, found it externally and internally an excellent remedy in case of smallpox, and also for eczema, impetigo, etc. But they have named it now together eczema impetigonoides. Where there is drying into crust and burning like fire. Here, the main symptoms, even for smallpox, the main symptom based on which they gave this medicine was that burning like fire. You can see this burning in case of sal, phosphorus, etc. But main symptoms that what for which they gave for the skin symptoms was actually this burning like symptoms. And it has been cured. This was cured, the smallpox or the eczema impetigonoides, by application of 1 part of Hydrastis tincture to 9 parts of glycerin, and when externally applied, the burning was removed at once. Then another case is saying that I means J.H. Clark. He saw once a woman, 60 years old, who had been given Hydrastis tincture in drops. GTT means drops in water 3 times a day. And after to that, maybe it could be a medicinal aggravation. The patient, after a week, came out in scarlet rash, raised and nodular, exceedingly irritable, especially at night. It was on every part of the body except the face and was worst on buttocks and elbows, all this reddish scarlet rash and the skin being raised and nodular here and there. So it was not on the face, but worst on buttocks and elbows, and it remained so for a week. The patient at the same time became very ill with sickness and general digestive disorder. And this has been mentioned as a medicinal aggravation when this was given, how much it was given. They just say it was given in drops and 3 times a day. The medicinal aggravation was seen when there was the scarlet redishness. The patient became very ill, the general digestive disorder that we say it as symptoms. Then a female genital organs also, it is very much affected, but there are symptoms of Materia, leukorrhea, pruritus vulvae, cirrus of uterus. Cirrus is a cancer, a type of cancer, which is very hard in nature, like what we say in case of calcarea floor, conium, the very hard type of cancer of breast, the same cancer. Nursing women with sore nipples. Weiss, another physician, gave a woman 31 years who had had adherent placenta. Now this was interesting. I never knew that adherent placenta we could give Hydrastis. But who had had adherent placenta in several confinements in succession. He gave Hydrastis 3x, 3 drops daily from the 4th month during her last 3 pregnancies, and each terminated without adherent placenta. So, yeah. But over here, the patient was actually having the history of adherent placenta in many of the confinements. So he started giving Hydrastis 3x, 3 drops only daily from the 4th month when placenta is actually getting formed. And he gave it like that for the last 3 pregnancies, and none of these pregnancies had the complaints of adherent placenta. And 4 other cases of habitual adherent placenta were successfully treated in the same way. There is much backache of severe character in connection to this. Then, like many other yellow remedies, there is a marked action on the liver, told that causing jaundice and liver enlargement. Cases of cancer of liver have been reported to cure by it. The leading indications will be this sensation of fullness in the stomach, and in the same stomach having that sensation of goneness or empty, which is almost constant, and also constipation were the leading indications in case of liver complaints. The constipation of Hydrastis is very characteristic. There is a torpor in the sense inactiveness in case of the bowels. Stools will be lumpy, but more than that, the stools will be covered with yellow, tough mucus. So that is the important feature over here. I told you whatever discharge that is coming out from their body, the Hydrastis, it is yellow, tough, and stringy. Even the stool will be covered with this yellow, tough mucus. That is the characteristic feature of Hydrastis stool. Hydrastis has been a good deal. Now this is a kind of case they are mentioning about, which was dealt by Miodovisky. But more than the case, what I felt was one sentence which we should keep in memory. So that's for this purpose I'm saying you this symptom. So Hydrastis has been a good deal used in bronchial catarrh with the characteristic tenacious secretion. We already saw that. I told you any discharge from any part of the body, any catarrh, it will be having that tenacious secretion. So in one case, an overdose brought on a characteristic attack of asthma. So in one of the case, we saw that the scarlet fever or the symptoms like that, redishness nodular, that came out. And over here, when the person was treating for the bronchial catarrh, the overdose actually brought about an attack of asthma. The dose was GTT, I mean, given in drops. Double X, I think they're mentioning 20 drops. So the dose was 20 drops of the liquid extract. And Miodowski, who reported the case, thought there was a pulmonary edema secondary to cardiac weakness induced by the drug. So this was actually being given for bronchial catarrh, and the person had the condition of asthma. And Miodovisky, he mentioned it could be due to the bigger dose, that is 20 drops that was being given, and that resulted in the pulmonary edema and causing the asthmatic effect. That's what's his explanation. But J.H. Clark say that it is not worthy to remember that the remedies which powerfully act on the skin can also cause an asthmatic state. So this is the sentence that I wanted you to remember. That's why I noted it down. Um, so the medicines when we are giving, if it is powerfully acting on the skin, if we give it in a larger dose, it can produce an asthmatic condition also. So please remember that. The symptoms are generally aggravated at night from warmth, from washing, the catarrhal symptoms from harsh dry wind, and also outdoors. Motion is aggravation. From touch, there is aggravation. Clothing feels uncomfortable, especially in the groin region. And amelioration is rest and pressure. We saw that earlier. Now, going towards the explanation of Kent. According to Kent, Hydrastis is actually a very slow, deep acting remedy, and it is required in many trophic disturbances. The word trophic indicates growth. So if there is any disturbance related to growth, which we already saw, the person will be having this defective assimilation, no proper nutrition will be there. So that is affecting his growth or causing any trophic disturbances. We can think about Hydrastis. But it is a slow and very deep acting remedy. There will be emaciation. Of course, the person who is having cancerous condition, if there is a defective assimilation, when he going towards the cachetic conditions, definitely he is going towards the emaciation. So there should be emaciation, catarrhal conditions, as we already discussed, liver, catarrh, the same nature, and also ulceration. Can be a simple ulceration or the ulceration related to cancer. This is a good remedy. So for Kent, it is the emaciation, the catarrhal conditions, ulceration, including malignant ulceration can be given. there is defective assimilation also. And here, the main indication should be the stomach is the center of all the problems. All the symptom complex, there should be the stomach. The desires and aversions often give the key to a very complex totality of symptoms. Though Kent mentions here the desires and aversions, it gives the key. He had not mentioned what are the desires and aversions of this patient also. Okay, he has not mentioned. But he gave the symptoms like in this remedy, the sinking empty stomach or sinking empty hunger, that's how he put it, but sinking empty sensation in the stomach with loathing of food. These are the two symptoms he gave importance to. It's the striking, strange, rare, and therefore peculiar, or the root symptoms we can say, the rare, uncommon, peculiar, or the characteristic symptoms. According to Kent, which we already discussed, is that empty, all gone sensation, and then loathing of food. That we have seen that the patient will be having no desire for food or even thirst. So for him, that becomes the peculiar nature. Then the catarrhal symptoms, we saw the thick viscid ropey yellow mucus, and sometimes it may be white from any mucous membrane with or without ulceration. There can be ulcer, even from the ulcers, the deep eating spreading ulcers, usually seen associated with cancerous conditions, upon the skin or mucous membrane with that characteristic yellow pus. This remedy has been very useful in the treatment of malignant ulcers or cancerous ulcers. In such ulcers, it is often a great comfort to the patient. Actually, this medicine, according to Kent, it does not cure. It does not cure any of the malignant ulcer. But what it does is it can remove the offensiveness associated. Because if it is a malignant ulcer, the discharge coming out, previously it will be offensive. So Hydrastis can remove that offensiveness. Yeah, that is one reason. Even if as I told, it can be given. Hydrastis can be given as a mouthwash for the sore throat or the ulcer, etc. But forget all those conditions. Sometimes people use for oral hygiene the mouthwash to keep their breath fresh. So even if we don't have, the patient is not having any ulcer condition or something, you can test this remedy for your own, because this medicine can be also used as a general mouthwash, not for any disease associated, but it can be used as a mouthwash, and that is because of the property it can remove the offensiveness, and it can modify that pain associated with the malignant ulceration and also control the destructiveness. So for these three features, Ken says we can use this medicine for the cancerous ulcers. It will remove, it is not going to cure the malignant ulcer, but it will remove that offensiveness, the pain will be reduced, and also it will prevent much more destruction happening to the skin and tissues. The burning so commonly found in such ulcers is a strong symptom of hydrastis. But yeah, this is another symptom. In chronic cases or any cancerous condition, whatever, the tissue destruction has taken place. The tissues have suffered, but not the mind. And by that sentence, what he means that is, we get a lot of pathological symptoms from the patient, the tissue symptoms, but not even one mental symptom. So that is the feature you see. There is an astonishing absence of mental symptoms. Because when we say a medicine is deep acting, slow acting, obviously we expect that medicine to have an action on mind also. But maybe Kent is explaining here the tissue destruction, or it's a completely pathological condition where the destruction have happened mainly on the body, physical level, the tissue level, but not the mind has affected. So there is a complete absence of mental symptoms, except the general discouragement incidental to long suffering and weakness is striking. So there is complete absence of mental symptoms, and if at all some symptoms are present, it will be just a discouragement, which is seen associated with long suffering and weakness. So, a person who is having cancer or an ulcer condition, imagine such a patient is coming, a chronic condition, for years and years is affected by this. By the time he comes, he will be already having a kind of discouraged mind that it is not going to get cured or something because of its long lasting affections. Only that what might be we get maximum in case of mental symptoms of hydrastis. Otherwise, the symptoms mostly it is in the mental sphere, it's completely absent. So, and can suggest that if it were carefully proved, most likely the mental symptoms, the love and hate would have come out. So, at Ken's time, it was not perfectly proved according to Ken. That's why the mental symptoms didn't come out. So we can, there is a scope to do a re-proving. This one, I already told you there is no appetite, no thirst, and also there is loathing of food, which is one of the characteristic feature. Nearly all food disorder the stomach, spitting of the food like phosphorus and ferment, vomit all the food, retains only water and milk, like a symptom of gastric ulcer. Then empty, faint feeling, loathing of food, and obstinate constipation. It's just the repetition of what we were saying, loathing of food and obstinate constipation with no desire to pass through. The combination must generally have hydrastis. There can be pulsations more than that. There is ulceration and also for suspicious lump in region of pylorus. The pylorus, the stomach part, the pylorus, the distal part of the stomach. So any cancerous condition over there. And mostly the stomach cancer will be seen in this pyloric region. This must be useful for a liver remedy, especially when the skin is jaundiced, the stool is light or even white, which shows the obstructive jaundice, and the liver is enlarged, hard, or nodular. So, as I told you earlier, once again making you remember, alcoholic patient who might have had some liver complaint, the cirrhosis, or some kind of obstructive jaundice, repeated attack, finally leading to a cancer liver, we can think about hydrastis. It has also cured obstinate piles, ulceration and fissures of anus, relaxation and prolapse of anus, paresis of the rectum resulting in constipation, especially when the stomach symptoms increase. Some the stomach symptoms should be that loathing for food, empty all gone sensation, which is almost always present. There can be chronic catarrh of bladder. This one I have already told you. Any part of the body there will be catarrh coming up, even that from bladder or urethra, chronic gonorrhea, leukorrhea, anything, any mucus layer, the catarrh is coming, and that characteristic yellow viscid stringy nature, we have hydrastis. Then some other symptom is epithelium of mamma or the mammary glands, which means the cancer of breast. There can be bleeding after coition. And warmth and washing aggravate ulcers. Urticaria over whole body aggravated at night. This is about hydrastis, cancerous condition when the symptomatology match, especially the stomach region, when the person is having that defective assimilation, the growth or the nutrition being affected, getting emaciated, then can be given for the precancerous condition and also the cancerous condition, especially with that characteristic discharge. If it is an ulceration, it will remove that offensiveness. The intense pain will be reduced, and also the further destruction will be reduced. Any discharge from the mucous membrane, that is the catarrh from any part of the body with that particular characteristic color, empty organ sensation, I think I mentioned, the loathing for food, and another feature was anything associated but no mental symptoms. That is Hydrastis canadensis. The third drug for today is Hydrocotyle asiatica, and I'm very sure you might have seen this plant, haven't you? This one, my mom used to pluck. I mean, we can see in the in our courtyard, the yeah courtyard now. It will be growing so fast. Like so, my mom used to use this. You might be knowing the coconut chutney, which is used with the thosai. So sometimes to make a difference, to bring that coconut chutney, otherwise it is always white in color. So sometimes my mom use, I mean, Tamil people, the Indian should be knowing, they will be using the red color or chili so that the chutney becomes red in color. Just to make, always we will see the white color. Dosha is actually the main thing. Over here you say dosha, but over in Kerala we say dosha. So it's a everyday breakfast, I could say, over in Kerala. One day it will be dosha, other day it will be idli. It will be changing like that, the same dough will be using. So to bring sometimes green color for that coconut chutney, she uses this leaves. So it will bring a green color. But when I was eating at that time, even she didn't know it had any medicinal properties. For her mother-in-law, that's what my mom used to say. Her mother-in-law used to say this is very good for health. So she used to mix it to just bring that greenish color. And someone was going to say something. What was that? Who was going to say?
No, I was going to say yes, seen before.
Okay, okay. Yeah. So this doesn't change the taste of the coconut chutney much. I mean, if you could, you can use. It brings a different taste. Different taste, not much difference. But the usual coconut chutney, the taste will be a bit altered. But I can't say it was nothing like sour bitter because it is having some smell, not bad also, not pungent also. So slight variation and that appearance it will be very greenish and that used to be. So common name is Indian pennywort and characteristics. It is curative in disorders that exhibit inflammation and also cellular proliferation. So whenever there is a skin complaint, when there is inflammation, reddishness, and also cellular proliferation. So psoriasis, and then another one, elephantiasis. Yeah, we can think about that because there is cellular proliferation that is happening. The skin symptoms are very prominent: hypertrophy and induration of connective tissue. So it is having considerable value in case of leprosy and lupus when there is no ulceration. It is also great use in ulceration of womb. And ulceration of womb or the uterus, it can happen in conditions of herpes, syphilis, genital TB, etc. when the ulceration has happened in the uterus. Okay, or generally when we are going to say about the skin symptoms, there is much hypertrophy and induration, but when there is no ulcerations. And in case of ulceration of the womb, there will be cervical cancer, the pains associated, and the patient will be having difficulty maintaining the upright posture. Though these symptoms are there, I would be asking you to mainly stick on with this hypertrophy, the skin symptoms, hypertrophy, induration, inflammation, and cellular proliferation. And associated, the concomitant, there will be very copious perspiration. There will be pain in left cheekbones and about the orbital region, not so important. In the female, it can be the pruritus of vagina. Uh, there will be heat within vagina. There can be inflammation of neck of bladder, the granular ulceration of the womb, cervical redness, everything that is indicating the cancerous condition of the cervix. There can be dull pain in the ovarian region and profuse leukorrhea also. But we'll mainly concentrate with the skin symptoms. In the skin, there is dry eruptions, there is great thickening of the epidermoid layer and the exfoliation of the scales. And because of this thickening, that is why we have the indication for leprosy, lupus, etc. And because of the exfoliation, we have the indication for psoriasis. So we can give it for psoriasis gyrate, or it was a older terminology. The current terminology is annular psoriasis, and annular psoriasis means the psoriasis. There are different varieties of psoriasis: erythroid or erythromoid psoriasis, then annular. There are varieties of psoriasis. So in this annular psoriasis, it will be the eruptions will be actually circle-like. That is the feature. So, so it is mainly indicated in psoriasis gyrate, especially on trunk and extremities, and also palms and soles. It will be circular spots with scaly edges. So this will be the psoriasis. Usually what we see commonly is actually present all over the uniformly one, but the annular only in the like a circle, and it is the edges that will be having that psoriatic features. The center will be usually not much characteristic. Here though there might be, otherwise nothing. This is actually, it seems like, looks like actually, what is that? Herpes sassinatus or the ringworm. But in case of ringworm, it will be much itching, and there will be reddishness. A central clear region will be there. But here, I mean, over there in ringworm, we don't see the skin being exfoliating, only because of that constant itching. The skin may be getting removed, and we see the reddish spots. But here also, yeah, similar to that, the reddish spots also will be here. The skin exfoliation will be there. So much similar to ringworm. There will be intolerable itching, especially in the sole region, profuse sweat, syphilitic affections, and also for leprosy. Also can be given for elephantiasis, and another suitable remedy for elephantiasis will be R-salve. But I don't know, in this well-developed skin condition or elephantiasis condition, if hydrocotyle is being given, how it is going to change, I don't know. But I have seen hydrocotyle being given, not by me, okay. One of my professor, and the patient was having not leprosy. The patient was having psoriasis, and not this one also, not the specific annular psoriasis, but the common one what we see. He used to give. There was a potency that he used to give to the patient. Along with that, he used to give hydrocotyle as a tincture. And in case of psoriasis, you know that the disease feature of psoriasis is it can undergo remissions and exacerbations. Like even without any treatment, that's what they say in the book actually. I don't know. Anyway, because all the patients who are having psoriasis, they will be taking one or the other treatment. But in the medicine textbooks, if we see, we'll see that they also say medication is actually steroids. But in the book, we can see that it is actually um, self-curating, like in the sense it will go off at a particular time. I mean, at a particular time means at some time, some stage, psoriasis will be getting cleared by its own, even if we give medicine or not given, and then it will return back. So it's a disease with frequent remissions. So this patient was a chronic patient of SIR. So I remember seeing him every Monday. Every Monday, so OP used to be on Mondays. Every Monday, this patient will be coming, and he will be taking the regular medication. So from second year to final year, and when we are during our final year, that sir got retired. So then the patient coming also stopped. But he used to come and take medicine. So once a while, not every time sir will be giving hydrocotyle. Once a while, sir used to give hydrocotyle tincture to him. Uh, so sometimes, and this patient used to come because sometimes the condition gets completely cured actually. I mean, cured in the sense we see there is a complete clear skin as if there is not even any mark that the patient had any psoriasis. But then this least trigger comes up, it will be back psoriasis. So such a feature is there. So that's the only clinical condition that I have seen hydrocotyle being given. But in a full-fledged elephantiasis like this, I don't know how much hydrocotyle is going to work. Have you given anyone hydrocotyle in your clinical practice? Okay, no, I guess. So really, I don't know. But yeah, maybe psoriasis. Really don't know. Because though I teach all the tinctures, as I always say, I don't trust these tinctures. Only a few like Ravelfia, Passiflora, Grangelia. Then what is that? That tincture that is prepared from our Blatta orientalis. All these I have seen some actions, Aspidosperma, but otherwise I rarely see actions with tinctures. Maybe my mistake, I don't know. And also I don't want to practice with tinctures, so I never tried to learn also. Anyway, so this can be also given for the lupus, the SLE conditions. SLE, the full form of SLE, systemic lupus erythematosus. For that condition also, there will be that characteristic butterfly rash. But a butterfly rash is just redishness, but here that thickness when it has come over. And the dosage is first to 6 potency. So that is for today. So what shall we do next? Should I conclude the class or should I give you some work for 10-15 minutes and then we come back after that? What you want me to do?
Anything, I'm okay.
And he's okay with anything. What about others?
Yeah.
Anyway, let I off the recording
Yeah,
entry.
but I think you need some rest because you keep talking.